Good morning, good afternoon, good evening, everyone. My name is Bea Spadaccini, and I'm the Internews Health Journalism Network Manager. We're just waiting to start, just a few more minutes, letting people come. And then we're going to dive into this conversation about One Health and how can One Health prevent future zoonoses and pandemics. Let me maybe share a little bit about the Health Journalism Network, which is a network of about 1,600 journalists from about 85 countries around the world. And it got started in 2020, October 2020, and it's growing. So you can join the network if you're a journalist or a health information provider by going to our website and just join. It's free, and it's a community of media professionals that are committed to covering health. So maybe just a few reminders for this event today is if you decide to post on social media, please tag us using at Internews HJN in caps for Twitter or X now. And also, if you have any questions throughout the event today, feel free to post them on the chats of whatever platform you're using to stream today, whether it's YouTube or Twitter, X, or Facebook. We have colleagues that are monitoring the chats, and we will open the Q&A at the end of this event for 30 minutes. It will be dedicated to Q&A from listeners and audiences on various platforms. So today's event is One Health. How can One Health help us to prevent future zoonoses and pandemics? I just want to start by defining zoonosis for those of you in the audience and the listeners who may not be familiar with this term. A zoonosis is an infectious disease that is transmitted between species, from animals to humans, or also from humans to animals. There are different kinds of zoonosis: bacterial, viral, and parasitic. But bear in mind that between 70 and 80% of emerging infectious diseases are known to be of zoonotic origin. So epidemics and pandemics usually result from the emergence or re-emergence of a zoonotic disease at the community level, and it's a localized transmission at first. An epidemic has the potential to become a pandemic when there is amplification and spread, just like what happened during COVID-19. Epidemic and then pandemic, because it amplifies and spreads. So there is ample evidence that humans are driving environmental changes that increase the risks of zoonotic diseases emerging and spreading. And today you will hear from a distinguished panel of experts about this very issue and how can One Health as an approach help us prevent future zoonoses. The One Health approach to emerging zoonotic diseases mobilizes multiple sectors and disciplines and communities to work together to foster well-being and to tackle threats to health and ecosystems while addressing the collective need for clean water, energy, clean air, safe and nutritious food, and taking action on climate change and contributing to sustainable development. I also want to remind you or let you know that there's 4 international agencies that have joined forces to accelerate collaboration across sectors and created a joint plan of action for One Health. This is very important because before, sectors were working in silos, but now there's really a convergence and a desire to work collectively and to coordinate and collaborate, especially addressing actions to reduce the risks posed by emerging zoonotic diseases, which is the focus of today's conversation. These 4 agencies, for your own information, are known as the quadripartite, and they include the World Health Organization, the Food and Agriculture Organization, also known as FAO, the UN Environment Programme, and the World Organization for Animal Health, which used to be called OIE. So let me give the floor to my colleague from Internews, Judith Gittins, in Barbados, who will tell you a little bit about this project. Over to you, Judith.
Thank you so much, Bea. Good morning to everyone. Is everyone hearing me? Just checking in with Graciela that I can be heard clearly. So as Bea said, my name is Judith Gittins. I am the Barbados-based program officer with Internews. And we have implemented a program called Building Community Resilience Through Emergency Communications and Preparedness. And this is actually the catalyst for why we are here today to discuss the One Health approach. So I just want to give you a little background to the project and how it supports this live event and vice versa. So Internews is embarking on new programming in the Eastern Caribbean territories of Barbados and Dominica. And as an entity that provides trusted information to communities that need it most, we embarked on a methodology we call the Information Ecosystem Assessment in communities in collaboration with our funder, the Clara Lionel Foundation, to assess how the role of local information ecosystems was helping to build the necessary resilience to disasters. So basically, how was information impacting emergency preparedness and response? And knowing that this region is impacted heavily by climate change, hurricanes, and the like, we also had the compounding issue, as Bea mentioned, of COVID, the health crisis. And we were embarking on this for the first time in 2020. And we utilize the IEA in a remote fashion. It is a methodology that is adaptable, and it was kind of a qualitative and quantitative assessment. And what the IEA highlighted for us was that there was a lack of preparedness of both citizens and even authorities sometimes due to varying factors. And it included gaps in pre and post disaster information from the media and authorities. There was some outdated, unfortunately inoperable and non-integrated disaster communication equipment. And sometimes information was slow to reach communities that needed it most, like persons living with disabilities, the elderly, because the methods of this dissemination were just not appropriate to reach those groups. So we tried to figure out, how could we fill those gaps with a project? And so we did embark on this 14-month multidisciplinary project that started back in May of this year. And it's providing what we call information and communication solutions to these communities that need it most. And we're helping to build, we believe, resilience to future health and climatic emergencies, utilizing information and communications. And there are three broad objectives. One of them is to strengthen disaster communications with vulnerable communities. Secondly, based on that major gap with the media, we're training information providers and media professionals on new tools and techniques for reporting on these issues. And thirdly, we saw that with the convergence of climate and health issues and what we are hearing as more and more a polycrisis in the world, that the One Health approach was actually one of the better approaches to tackling this. So we thought it would be opportune to develop a One Health toolkit for information providers to help share pertinent information, both from a global perspective, but also regional and locally, to discuss this holistic approach to broadening the health threats at the animal, human, and environmental interface. So what we're hoping for today is to learn from our expert panel, to have them share their experiences, to have you contribute as well as the audience. And we want to be seen as a trusted source of relevant information in this area. We believe this information is pertinent not just to the media, but those of you working in disaster risk reduction, young people, civil society, certainly academia, and those working in the health and sciences. So today we are going to be looking, as Bea said, at zoonosis. And I just wanted to touch a little on why this One Health approach is so important for the Caribbean. As you well know, and I said before, climate change is really, a global crisis, and we're experiencing more extreme weather, particularly in the Caribbean, severe floods, more hurricanes. And what's compounding this now is the distribution of disease vectors such as mosquitoes and ticks. We have right now a serious increase in mosquito-borne diseases like dengue, and we had Zika. And I must say, dengue right now is at an alarming rate. Similarly, antimicrobial resistance is another major health challenge facing the region. And we really believe that this approach can help the Caribbean to address these complex health challenges. So we look forward today to an engaging discussion and participation, learn more about how we can collaborate and coordinate across sectors. And I also want to make a plug here. When we talk about collaboration and coordination, let's not forget our media. So thank you very much, and I hope we have a great discussion today.
Thank you very much, Judith. And this is, I'm very excited, and this is going to be a fantastic conversation. So let me start with introducing the panelists that are here with us today. And it is my honor and pleasure to introduce my former colleague at USA, Dr. Dennis Carroll. And we had the pleasure to work together for a few years. Dr. Dennis Carroll has over 30 years of leadership experience in global health and development. Until 2019, he served as the director of USAID's Emerging Threats Division. In this role, he was responsible for providing strategic and operational leadership for the agency's programs addressing new and emerging disease threats. He provided strategic leadership for the agency's response to the avian influenza H5N1 outbreak of 2005, the H1N1 pandemic of 2009, and the West Africa Ebola epidemic of 2014. Dennis is a senior advisor on global health security for University Research, a company that focuses on strengthening health systems globally. He's also a distinguished professor of Faculty of Medicine at Chulalongkorn University. I'm sure I butchered this name, but he can tell us a little bit more about that. And he's a senior fellow at Tufts University, Center for International Law and Governance. In his career, Dennis has been responsible for high-level initiatives that have built effective partnerships across multiple sectors and between the public and private sector. Fun fact, Dennis and his family live part of the year on a boat. So I'm plugging in fun fact. Next, we have with us today, and maybe Graziella, you can show the screen, Dr. Chris Oura. Hello, Chris. Chris is a professor of veterinary virology at the School of Veterinary Medicine, Faculty of Medical Sciences, University of the West Indies in Trinidad and Tobago. Chris has worked in many countries around the world, including the UK and Mexico, Uganda, and Zimbabwe. He took up his post at the University of the West Indies in early 2012 and is currently running a One Health-based research program. He has recently received the University of the West Indies Vice Chancellor Award for Research, is a member of the World Organization for Animal Health's Biological Standards Commission, and is leading a Caribbean Climate Change and Health Leaders Fellowship Program. I do have a fun fact for Chris. Chris has played rugby for over 35 years, and he has managed to come out with his ears intact. Thank you, Chris. Next in line, we have Dr. Patricia Patty Bedford. Welcome, Dr. Patricia. Dr. Patricia is a doctor of veterinary medicine and obtained her degree from the University of the West Indies in Trinidad. Dr. Bedford is an animal and health livestock specialist and the antimicrobial resistant sub-regional focal point for the Caribbean and the quadripartite AMR multi-stakeholder partnership platform, specialist for the Food and Agriculture Organization, or FAO. She's based in Barbados. She's also the president of the Barbados Veterinary Association and the chairperson for the Carib Vet Communications Working Group. I just want to say that from 2003 to 2008, Dr. Bedford opened and ran a mobile animal practice in her native island of Barbados. And then in 2008, she moved to Minnesota to attend the University of Minnesota, where she obtained a Master of Public Health in public practice and a residency postdoctoral fellowship in veterinary public health. Fun fact for Dr. Patricia Bedford is that she's a trained beekeeper. Next, we have with us Wesley Gibbings. Hello, Wesley, welcome. Wesley is an author, journalist, and media trainer and press freedom campaigner who has been in the media business for over 40 years. He has trained journalists throughout the region and authored, co-authored, edited several training manuals for use by Caribbean journalists, including Reporting the Climate Crisis, a handbook for Caribbean journalists that was published in 2020. Wesley has served as a journalist lecturer at the Caribbean School for Media and Communication, University of the West Indies, Mona, Jamaica, and is currently a member of the team of journalist trainers retained by the Media Institute of the Caribbean, an association of the Caribbean media workers. In 2017, Gibbings was recognized for his journalism and press freedom activism by the U.S. National Association of Black Journalists and received the organization's Foreign Journalist Award. In 2022, Wesley received an Excellence in Journalism Award from the Trinidad Tobago Publishers and Broadcasters Association. Of course, I have a fun fact about Wesley. First of all, I want to share that he's a published poet with 5 collections to his name, and that today he's in Grenada, and this morning he was at the sea and painting waves. Thank you, Wesley. So, welcome everyone, and we can begin this conversation by hearing from Dennis. Dennis will talk to us about 6 lessons learned from previous pandemics that draw on his extensive professional experience as a global health security expert. He will explain how virus surveillance is done and the outcomes of various global initiatives, such as PREDICT Project and the Global Virome Project, as well as highlight some of the challenges this collaborative work faces. Dr. Carroll will help us think what is necessary to better manage future zoonosis with a focus on One Health approach. So, Dennis, you have 15 minutes. The floor is yours.
Thank you. And Judith, both of you, thank you for the opportunity to participate in this discussion. And really, congratulations for you for again bringing the important discussion around One Health and how it matters to our own individual health. So today, what I really want to talk about are lessons from the past 20 years of responding to pandemics and epidemics. It's important to recognize that after every single epidemic or pandemic, we have an opportunity to learn from those experiences in ways that should give us better insight in how to better prepare for, respond, and even prevent future events like that happening again. So what I'd like to do is just walk through what are 6 key lessons that pretty much have been the core of what we should have learned. From the beginning of 2003 with SARS, all the way up through the COVID-19 pandemic. If I could ask Judith, if you could put the slide on. Great, thank you. Well, let me first off just by saying one of the lessons I think we all appreciate from COVID-19 is that a threat anywhere is a threat everywhere. Events that began to unfold in Wuhan, China in December of 2019, within 2 months of that date, the whole world was swept up in a global pandemic. So no matter how far away and how remote an event might be, the spillover, as we talked about, of a virus or bacteria from an animal reservoir into people can very rapidly become a global event. And this is important because when we think about how we respond to such events, how we prepare for such events, no country, no community is isolated. We need to see all of these events as a shared global, a shared community event that requires a coordinated global response. The second lesson is that COVID-19 needs to be understood as it is not a black swan event. You may have heard early on in the COVID-19 pandemic, people referred to it as a once in 100-year event. Well, the truth of the matter is 100 years ago, that might have been the case. But the difference between 100 years ago and today is that the world's population has grown at a rate unseen throughout our history as a species. 100 years ago, there were about 1.8 billion people on this planet. Today, there are now over 8 billion people. In 1 century, we have added 6 billion people to this planet. Think about it for a moment. As a species, we emerged somewhere around 300,000 years ago. And it took us almost the entirety of that 300,000 years to hit the 1 billion mark. Yet in 10 decades, we added an additional 6 billion people. The significance of this is that our expanded footprint on this planet has dramatically altered the balance, the ecologic balance that has existed throughout the life of our species. Those events that may have been 1 in 100 years ago now are happening with much greater frequency because our interactive dynamics with the world around us, our incursion into wildlife areas, our building of cities proximal to forests and jungles, our disruption of the ecosystem for expanded agricultural activities, all has changed that long-standing balance. So rather than these events being once in 100, we're now faced with the new reality. We are likely to see these once every 5 years, 4 years, 3 years. We used to say Category 5 hurricanes were once in a decade, once in 2-decade events. But as we've seen now, well, again, as a consequence of our disruptive effect on this planet with increased population, hurricanes are a much more common event, much more ferocious. Category 5s don't happen once every decade. They now happen multiple times every year. We live in a different world, and it's important to understand that. These are threats that we need to be prepared for on a daily basis, not on a 100-year basis. The third, and this goes back to the core of One Health, every future pandemic virus that we are likely to face over the next 20, 30, 40 years, that virus already exists. It is circulating in wildlife animals, much as the COVID-19 virus, SARS-CoV-2, before December of 2019 was circulating in bat populations in southern China. The fact of the matter is, any future threat we will have already exists. This is, again, an important opportunity for us to recognize that we don't have to wait for the virus to come to us before it's discovered. We have the opportunity to develop a surveillance system which really exploits this understanding that those future threats already exist. We have an opportunity to take surveillance to the virus before the virus comes to us and use that knowledge to be better prepared, to be more able to respond quickly when a future threat emerges, and most importantly, to be able even to prevent a future threat from happening. We also know, and this goes back to work, as Bay mentioned, I oversaw our emerging threats program for the last 20 years. And over the course of that, we have learned not only that every future viral threat already exists, but we also understand the world at large is not at equal risk of being the place where new emerging threats will emerge. That there are, in fact, certain hotspots on this planet, geographic areas where the spillover risk is greater than anywhere else on this planet. And again, it goes back to population, where we see the greatest growth in human population in areas that are rich with mammalian species. The interactive dynamics in those places elevate the risk of spillover. So in the opening video, you saw a global map where certain regions of the world were lit up in yellow. Well, those regions we know today to be the hotspots for tomorrow, that those are the places, if you're going to use this knowledge that viruses already circulating in wildlife can be detected now to protect us tomorrow, then we have the opportunity to use this knowledge in a way that gives us a forward-leaning capability. We don't have to be reactive. We can be proactive. Go to the virus in these hotspots. Look at the behaviors in humans that elevate the risk of spillover. Again, how we market animals in animal markets, how we grow our food. All of these are things that we have a chance to better manage. We have a chance to lower the risk of future threats. Knowing where to look, what species of animals to look in, and what geography and behaviors that we bring to the table allow us to be much more insightful about better preparing for, responding to, and preventing. The fifth point really has to go to what I was just talking about, which is knowing where hotspots are. We don't have to look everywhere for future emergence. We can target our surveillance. We can target our monitoring of elevated risk in those areas where the hotspots are greatest. It allows us to be smarter, strategic, and ultimately far more effective. It transforms our ability from reacting to future threats to being able to be disruptive and prevent a future threat from becoming a global pandemic or an epidemic. The last point that I want to make has to do with something that really hadn't registered strongly in the previous epidemics and pandemics, whether we're talking about SARS or Ebola or Zika. The issue of politics and political leadership had never risen as a major disruptive force. What we learned in COVID-19 pandemic, however, was where we saw leaders step forward and use the tools that had been put in place over the previous 20 years, knowledge that I've just spoken of, that has allowed us to be better prepared. We saw countries where leaders applied that insight. We saw that their impact of COVID-19 was far less than those countries where leaders squabbled and the issues of public health became a public debate. Ultimately, we have seen in North America, my own country, levels of mortality that never should have happened because of the failure of political leadership. So no matter how smart and insightful we can be about where to look, how to be disruptive, how to better prepare and prevent future threats, we can't do that without political leadership at the national level and at the local level. Collectively, these 6 lessons are the backbone as we think about how we will meet future challenges. We have the opportunity to stop being victims. We have the opportunity to be able to prevent future threats from ever playing themselves out with the catastrophic effects that we saw with COVID-19. So as Barbados and the Caribbean islands are not a place for hotspots, as we've seen with climate change, they are, however, a place where they can become victims. The opportunity to use this knowledge to better prepare will allow us to prevent and create a far more resilient society. So I'll end there. Thank you for the opportunity for this engagement, and I look forward to learning more from my other colleagues on this panel and then having a chance to discuss with the participants. Thank you very much.
Thank you so much, Dennis. Really thoughtful and insightful lessons that we can all really let marinate because they're just really amazing. So let's maybe, I'd like to start by going to our other panelists and really have them tell us, maybe starting with Dr. Patricia Bedford, as I know she might be leaving us a little earlier. How is One Health relevant to your day-to-day work, Dr. Bedford? And do you have any current or future activity related to One Health and its implementation? Perhaps also thinking about some of the points that Dennis raised and the lessons learned. Over to you.
Hi, thank you very much. I'd just like to start by saying I am traveling today. So I am in the airport right now and I'm using their internet. So excuse me if anything goes wrong. Let me know if this feed does not come through well enough and I'll have to turn off my camera. Dr. Carroll, thank you very much. I must say that I found your opening remarks very insightful. And since I've been in this public health sphere now for over, I think it's about 15 years, I must have been hearing the same thing over and over within our community. I don't know if there's a disconnect between our community and getting the message out, but maybe this is a great media, because you spoke about political will needs to be part of the process. But I think the media also plays an important part. And this is why I was quite happy to join this panel today, because without correct communications and informative communications being sent out to the public, that is also a cause for concern. As far as One Health, I am presently engaged in an AMR One Health activity. There is a quadripartite multi-stakeholder platform that was launched last year and is actually in the implementation stage this year. You see a smile coming on my face because I'm very excited about it. I'm very hopeful about it, because it is really a bottom-up approach that we're using. When I say quadripartite, it involves the World Health Organization, FAO, which I consult for, MOA, formerly known as OIE, and UNEP, which recently joined. So we are covering all of the bases, and we are reaching out to stakeholders all across the globe. The Caribbean is part of it, and University of the West Indies, where Professor Orr. I'm sorry, you're going to hear me slip into first names because I'm a first name person and I know Chris. So the University of the West Indies is part of it, both Cave Hill campus and Mount Hope. And we have a number of countries that have become part of it. And as I said, it is a One Health approach. When I say the University of the West Indies, it is the School of Veterinary Medicine, the Faculty of Medical Sciences, and the Faculty of Sciences. I know it has changed since I was there, the name, so I don't know the correct name. It used to be called Faculty of Natural Sciences when I was there. So we are reaching out to a wide variety of stakeholders. I also presently engage in my extracurricular activities, I would say. As was mentioned, I am the chair of the communications working group for Caribbean Animal Health Network. But not only that, during the volcanic eruption in 2021 that occurred in St. Vincent and the Grenadines, we formed an ad hoc response group. Originally, it was only mainly made up of animal health practitioners, but it turned out to actually be multidisciplinary, because we have lawyers involved and we have so many people from other walks of life. Yes, we responded to the animal sector, but the persons that we had to bring in to the fold to actually get information is from a wide range of persons. So I think I'll stop there because I think I've been speaking a bit too much, and I'll turn it back to you, B, and the other panelists.
Thank you so much, Dr. Bedford. Especially appreciated the bottom-up approach and what you mentioned that you're very excited about because of this bottom-up approach, to also implementing the One Health approach from the bottom up. And I'd like to ask the same question to Professor Chris Aura. How is One Health relevant in your day-to-day work? Do you have any current or future activity related to One Health and its implications? Over to you.
Thanks very much, Bea, and it's a pleasure to be here. Thanks very much, Dennis, for your excellent opening remarks. Yeah, so I've been in the Caribbean now for 12 years. It's shot by. And I suppose when I'm looking towards how One Health is relevant to my day-to-day work, one of the big things that I've been attempting and trying to do is getting the One Health message out there, because as Dennis was saying, it's so critical that people in pretty much all walks of life recognize the connections between the health of humans, animals, and our environment, because they're absolutely intimately linked. So I do a lot of teaching at the University of the West Indies, and so one of the things that's extremely relevant in my teaching is to get the One Health message across to our students. That's our medical students, our veterinary students, our dental students, our social scientist students, our economic students, to make sure they understand how important it is to take into consideration these connections. And I give lectures to various groups of students, really starting off by emphasizing how important their particular discipline is. Because One Health is not about knowing everything, one individual knowing anything, a doctor or a vet or a dentist or a social scientist knowing anything. It's bringing your expertise to that table, and it's making sure that the correct and the most important people, the people that are needed, are around that table to give their expertise and their influence. So a particular health issue, be it AMR that Pat was just mentioning, or endemic or emerging zoonotic diseases, as Dennis was mentioning, or be it climate change and health, or be it food and water security. We have to make sure that we attack these big, pithy, wicked, complex problems using a multidisciplinary, intersectoral approach, getting out of our silos and making sure that we get the appropriate people involved who can contribute. So it's really getting that message across to, say, the medical students, how important their role is, and the veterinary students, how important their role is. And also in the research projects that I carry out, again, it's important. It's really important to understand these connections and not only bring in the human, animal, environmental elements, but also bring in the social, the economic, and the cultural determinants that affect the disease or the pathogen that you're so all the health problem, be it, as I said, climate change and AMR. And finally, I suppose one of the things that I've been doing a lot over the past 10 years is training professionals across the Caribbean in key issues around One Health. And I think this is critical, really, because it's changing the mindsets of the people that matter. And that's making sure we open their minds up to making sure that they understand that they need to use a systems approach. And if one cog in the system stops, then the whole system breaks down. And we train leaders in a sort of collective leadership from appropriate for systems. We train them in One Health. We train them in climate change and health. And these aren't so much students, undergraduate students, or even postgraduate students, although it's important that they get the message as well. These are professionals that are in a position to affect change. So working in Ministry of Health, Minister of Agriculture, Minister of the Environment, people working for civil society, people working in the private sector, people working in academia, who are in a position to affect change, who can take those important reports and surveys and that are produced so much off the shelves and make sure they're actioned, because that's what we need now. We're in an emergency situation in so many ways, and it's emphasized by climate change, but also, as Dennis was saying, about this is not a situation where we're going to get emerging pandemics every 10 years. This is going to be much more often than that. So we're in a real emergency situation that demands this One Health approach. So we need actually professionals who are working now within a position within the ministries across the Caribbean, across the world, who can actually affect change and have the knowledge and skills to affect change. So this is what this work we've been doing, actually focusing on these professionals, are. So it's very exciting, but it's very needed at the current time. And the One Health approach is really at the core to making sure that we manage these big health issues that are so at risk from in an effective and more efficient manner going forward. So I'll stop there. Thank you.
Thank you so much, Professor Ora. I think it sounds like collaboration is key. We know that with One Health, but as we've seen in the pandemic as well, getting everyone to collaborate and to sit around the table with the right expertise is extremely important, and it's also challenging. I was just recently at an event here in Italy, and I was told by some of the veterinarians that One Health is now, and veterinarians are now reporting to the Ministry of Health as well. So it's interesting how even within countries, they're starting to shift lines of management to make it more inclusive as a One Health approach. So let's hear maybe now from Wesley, and who can also speak on behalf of journalists and information providers. How is One Health relevant in your day-to-day work, Wesley? Do you have any current or future activities related to One Health and its implementation? Over to you. Thank you.
Great, thank you very much. It's a great feeling that I can participate on a panel such as this. You know, coming as I do from the orphan science of journalism, but it's not completely irrelevant to the discussions that we're having today. During the course of my journalistic career, spans 40 years, what I've found is that much of what has been said by all of the the scientists, the other scientists on the panel, are so absolutely relevant to how we engage the practice of journalism in the Caribbean. One, when it comes to the question of health and the relationship, the interconnectedness between the humans, the natural environment, and animals, what I have found is that in coverage of matters related to catastrophes and what some people erroneously describe as natural disasters, that there is this assumption by our subjects, the people that we interview, the people that we interact with, there's an assumption of the relative benevolence of the natural environment. Some of that is based on traditional belief systems. Okay, so all will be well. So things can happen in the ocean, things can happen in the forests, but all will be well in the end because for some reason or the other, rationalized by traditional belief systems, there is a way of things will even out. And the interactions between the natural environment and humans is one that has a balance that will eventually, an equilibrium that will eventually be achieved. Now, in covering extreme weather events, for example, this comes across on a regular basis, and we often find ourselves quoting people who are suggesting that that's okay, all will be well, even though we are experiencing the effects, because they are long-standing effects, but are becoming exacerbated by climate change now. The other thing about it in terms of media coverage, and not only media coverage, but public policy on such issues, planetary health, and I'm being advised not to use it interchangeably with what we're discussing today, is that has been a tendency both at the level of media coverage and even public policy and public interaction, the interaction of public officials and media, to dwell on or to focus on single cause dynamics. So something has happened in a particular area and it's because of X. And there is a failure many times to draw this whole notion of the interconnectedness of the experiences that we are currently undergoing in the Caribbean, whether related to health issues, that zoonosis, or whether we're talking about climate change or other things, and the interrelated nature of it. So that leads into another observation that I make in terms of regional coverage of these issues, which is that there is an absence, even by the scientists, because when the COVID-19 pandemic emerged as an area of very serious concern, there was a level of unevenness in terms of public policy interventions throughout the Caribbean. And I think it was based on the weighting of the different scientific disciplines and the weighting of the required weighting, WEIGHTING, weighting of what in the scheme of things whether it was science or whether in public policy, which factor was more important than the next. So even though you had a cross-curriculum agreement that they would have a common approach, if you move from country to country, there was a different weight was applied to different aspects of the science and different aspects of the required public policy to address the pandemic. One of Dr. Carroll, it was who introduced the whole issue as well of politics. And I've been sort of using that interchangeably with the notion of public policy, because public policy is informed to a very great extent to the public politics of the day. Misinformation and disinformation, that to me was the single greatest threat beyond the presence of the virus itself in the Caribbean and sort of the deadly consequences that arose. Misinformation and disinformation, in my view, contributed to some of the worst impacts of the COVID-19, the virus, and the ongoing pandemic throughout the region. So I'm going to stop there because I'm sure that I hope that I get some feedback from the expert panel, and I'm also quite willing to respond to other things they have said.
Thank you so much, Wesley, and I'm so glad you touched on the issue of misinformation and disinformation that we have seen fueled at levels never seen before during this pandemic, probably also because of the use of technology and social media platforms and all of that. I wanted to go back to the focus of this project and this talk as well, with the words of community resilience, building community resilience. And maybe I'm going to ask my colleague Graziella if she can put back the slide of the 6 lessons learned that Dennis highlighted. Thank you, Graziella. And I'm wondering if the speakers could, the other panelists could reflect a little bit on these and how in their respective roles, which one of these lessons learned is most useful for thinking about building community resilience through One Health. And maybe which one of these is really something you didn't expect to see as a lesson learned, but can really be an opportunity to reflect on how to build community resilience, especially in the Caribbean region, where extreme weather events are frequent and devastating, like other parts of the world, but certainly in the Caribbean region. Maybe I'd like for keeping these lessons there for, again, Dr. Bedford to take the floor and share some thoughts about these lessons learned and building community resilience from your perspective. Over to you, Dr. Bedford.
That for me, please. I was disconnected for a while.
Did you hear my question?
No, could you repeat it for me, please?
Sure. I would like to know from your perspective, where you sit, how some of these lessons learned can inform building community resilience to respond to future zoonosis and pandemics. Is any of these a surprise, or in your work, what's your takeaway from these lessons learned when it comes to building resilience?
I think for me, I'm a big proponent of education. Being able to inform, if we're speaking about the public, inform the public of, I'm going back to my risk communication, what you know, what you don't know, or when you'll be able to get some information about it. I think one of the big mistakes we make is trying to gloss over things for the public. So that's for the public. For the at the professional level, we need to engage before any disaster, any disease, anything like that. Because as we've been speaking about this entire time, collaboration is key. When we speak about One Health, it's all about collaborating. So if we get to know the persons before We have to work with them. That helps. Because there's sort of things that have to be in place all of the time if we want to respond to any disaster or any disease. So I think those two things, from what I have learned in the past years, are the key things right now where we sit, especially in the Caribbean. And when we're dealing with quite a lot, because right now we're dealing with transboundary diseases in the region. The globe is dealing with transboundary disease that has potential and has been zoonotic, and most importantly, climate change, which I think is a big game changer. And we haven't really, I don't think we're dealing with it enough, and we're speaking about it enough. Hopefully with UNEP now joining the quadripartite, the input would be an extra benefit to our responses. Bea, back to you.
Thank you, Dr. Bedford. This issue of messaging and education, risk communication and the public, the messaging during epidemics and pandemics is really key. I'd like to turn to Professor Oura to perhaps reflect on some of the lessons learned and ways of building community resilience from where you stand, Professor.
Yes, I mean, I think there are lots and lots of lessons that we need to learn, and I think the past says that we often don't learn these lessons. So I know from the 1918 Spanish flu, there was, from a journalist perspective, there were very few or comparatively few articles written for many years, quite a few years after the 1918 pandemic, because it seems that people had a kind of collective amnesia. They didn't want to remember. They didn't want to even think about the horrible situation that happened. And I think there's a danger now, even with COVID-19, that we're not going to learn those lessons because people don't want to even think about it. It was such a dreadful experience. So we have to be very careful about that. There are so many lessons we need to learn. And one of the key, Dennis's key lessons was a threat anywhere is a threat everywhere. And that really, really emphasizes the point that we all across the world have to be better prepared. We all have to understand where our more vulnerable populations are and map them. We have to improve our health systems so people have better access and there's better equity. And as Pat was saying, we need to be proactive rather than reactive. And that's very difficult because our politicians don't like to be proactive so much because it costs money when there's not actually the health problem that's in everybody's minds at that very time. And I'll just give a little example. For example, in the Caribbean, we all remember Zika virus when it came through and affected really seriously pregnant women and caused major social economic issues, not only for the people that had disabled babies, but also for the countries that had to deal with those disabled babies. And we knew that virus was coming to the Caribbean because it arrived in Brazil a few years before, and it was spreading up through South America. So at that stage, we needed to get together, as I said, around the table, all the disciplines, all the people that needed, all the experts that need to be involved in the process of understanding how we best respond to and react to an outbreak of Zika virus. So we make the best decisions for our vulnerable communities, our people. So we need input from the doctors. You know, this is a very serious human disease. We need input from entomologists. It's a mosquito-borne disease. We need to understand the social implications, the economic implications. We need to understand. We need to bring in a private sector involvement because they're the people that produce the drugs and the vaccines. We need to bring in the vets and the agricultural people because often these viruses, including Zika, they have an animal reservoir. And critically, we need to bring in the international organizations and the policymakers, because it's those policymakers, those government members, that actually make the decisions about how they're going to fund any action, any response. So we need to be really understand, and we are doing a lot of great modeling now to understand from these hotspots that Dennis talked about, how will these pathogens spread, where will they spread, which populations will they spread to, and how do we engage, and this is where the media comes in, how do we engage with those populations, those often vulnerable populations, so we reduce the impact of these health issues on them. And that's all about, a lot of it is about communication in that way. So I think there's lots we need to do, lots of lessons we need to learn, but we need to make sure that we learn them. Thank you.
Thank you, Professor. It seems like learning is easier, or collaborating may be a little easier when there is a disease outbreak, and it just forces people to collaborate instead of ongoing collaboration to prevent. So this is a big one. Wesley, would you like to comment also on the lessons learned that Dr. Carroll highlighted before, and from your standpoint, from your perspective, how to build community resilience? Which lesson of these 6 lessons that Dennis presented resonates with you mostly as a journalist, as an information provider?
Well, let me begin by saying, and I just listened very carefully to what Dr. Ura had to say with respect to the challenge of public communication. And of course, Dr. Carroll made some really seminal points around that. And if you ask, how can journalism play a role in terms of promoting the notion of One Health? I would say, one, it would have to be with great difficulty, because as I hinted, what we are fighting, what we are combating, really are issues of cultural and political belief systems that are very hard to break. And you're even dealing with sort of some of the systemic issues that related to the structure of our economies. Because, for example, right now in the Caribbean, we are undergoing different stages of dengue outbreaks. Whether you talk about Barbados, I'm in Grenada now, Guyana, it's there. And everywhere there is this contestation about the level to which people should be exposed to the fact of the imminence of an extremely serious outbreak of dengue. Just to cite one example, and we have experts here who I think can dwell more on the science, but I'm talking about the communication aspect. In the tourism dependent countries, there's a tendency in the direction of self-censorship, and a self-censorship that's fed by official dicta to suggest that, listen, we need to be careful about how we convey messages about this thing, because we don't want to turn tourists away if there's an episode of dengue and so on. So it's an extremely difficult thing. But one of the key lessons learned during the pandemic era, to go back to Dr. Carroll's presentation, is science, is the contribution of science that comes up against all kinds of very, very well set public predispositions. And those predispositions relate to the politics, because you found that there was unevenness throughout the Caribbean, not only at a regional level, but at national levels, where there were mixed messages depending on which political side of the fence people who are being quoted in the press resided. And you're dealing with a situation in which, as I said, there is this tendency to dwell or to focus on single cause dynamics, when in truth and in fact, what we're dealing with is a hugely multifaceted phenomenon that requires a very sophisticated approach, but one in which everybody needs to come to the table and say, listen, this is how we need to get this to work. And you need to put in the mix the whole parallel phenomenon of journalistic skepticism, because we are going to begin from a position of doubt until you prove that the point that you're about to make is valid.
Thank you, Wesley. Thank you so much for your comment. This issue of fragmented messages across the Caribbean region, I think, is something that also unfortunately happened in many other parts of the world. And when public authorities and different stakeholders look at and reflect on the pandemic, they see this fragmentation of messaging. So we are now at the hour. So we have about 30 minutes of Q&A. And I do have a few questions that have come in from different platforms. So I would like to perhaps call on different panelists and Dr. Carroll, depending on the question that comes in. This particular question is for Wesley. The question is, you mentioned during the COVID-19 pandemic, the dramatic rise in misinformation and disinformation, which have fueled mistrust in public health institutions and frontline responders. What can journalists do, in your opinion, to increase trust between the public and government institutions to address future emergencies and disasters?
I think a good
Yes. Thank you. Over to you.
A good starting point would be to have a much firmer grounding in terms of our reportage in science. I think that we need to be guided by science to a far greater degree. The other thing, I think we need to also expand the basis for source information. What you find in most of our countries is there's a very narrow band of people that journalists turn to for comments and for analysis and for perspectives. And unfortunately, the first point of contact tends to be the politicians. And the politicians, in my view, have been among those that have caused greatest harm during the course of the pandemic on all sides of the political fence. And as I suggested, that there was this dichotomy between the sense of urgency being attached to the pandemic by those that were in power and those against those who are in opposition, because pandemic measures, many of them tended to be pretty painful, and there are politicians who decided that there was political gain to be achieved from conveying messages that conflicted with what official public policy. Of course, there are many, many instances in which some countries prefer to err, if they did, on the side of extreme caution. So yes, there is an ongoing argument. In fact, there are people in the public space who are well trusted in the arena of medicine and science who continue to suggest that there was a tremendous amount of public policy overkill when it came to the pandemic. And the way I've addressed that in my columns is that I have pointed to the fact that perhaps there are officials who were interested in erring, if they did, on the side of extreme caution in order to save lives and to some extent to save livelihoods.
Thank you so much, Wesley. This issue of sources and always going to the same sources, the tendency of journalists, which is also what we try to convey in the Health Journalism Network of Internews, to really encourage a diversification of sources, credible sources, evidence-based information, scientific training, because if you cover science and health, you have to be trained continuously to understand the evolving science and the nature of science that is evolving all the time. There's another question, we're monitoring the chat, but for Dr. Dennis Carroll about how do viruses transmit in hotspots from animals to humans, and what can be done to prevent that? Can you give us an example?
Great, thank you. I actually, Bay, I shared with you a video. Could we put this video up? And before we start it, let me give some backdrop. This is about a 25-second, 30-second video in South Asia, there is a virus that we're concerned about. It's called the Nipah virus. It's one of the most lethal animal viruses that we know of. It circulates in wildlife, essentially bats. And we began seeing outbreaks of Nipah in Bangladesh about 15 years ago. And there wasn't real clarity on how that transmission was occurring. But what we did notice were a couple of things. The people that were principally first infected were all part of a community of people who had jobs in the date palm sap industry. That is, every February, March period in Bangladesh, there's a collection of date palm sap, a syrup that comes from the date palm. They would climb up the tree and scar the upper portion of the tree to let the sap begin dripping. And then they would put a gourd down below and collect the sap in that gourd. It's a very sweet delicacy. You would take that gourd and you could either drink it raw, very sweet, or you could boil it down and turn it into sweet cakes. So it's a very popular, widely used sort of natural product, not that dissimilar from maple syrup that's consumed here in the United States. What we did to try and understand what was happening, some very clever work was done putting a night camera up, monitoring to what extent the syrup itself was becoming infected, the sap. And what you see here is a night video that shows a bat that also has a sweet tooth. And what you see in the lower portion of the picture is the gourd. And up above the upper portion is where the tree has been scarred. And what you're looking at is a bat at night has come down to the palm tree and is licking the syrup as it flows into the gourd. It then, as you see right now, turns around and then urinates into the gourd. Viruses that are in bats, the two critical ways they can spread a virus from a bat into another animal is through their saliva and through their urine. And we have a perfect example here of how a bat used the sweet taste of the sap as a place where it could then infect the gourd with the virus. And then when the worker collected the gourd in the morning, they would be exposed to the virus. And that is how the transmission of Nipah virus was occurring in Bangladesh. What we did with the local community was to use sort of local solutions. What they ended up doing was taking pieces of bamboo and creating a skirt, a little fence that went around where the scar and the gourd was, a physical barrier that prevented the bat from being able to get to the sap. And that right there protected against the risk of the bat transmitting the virus into the gourd. So not only do you have an understanding of how a dangerous virus circulating a bat could end up in humans, but you could also identify then simple solutions that would protect people. We could say the same thing about other viruses, the Ebola virus or the avian influenza virus. Understanding how they are transmitted from the animal into the person allows you then to intervene and develop simple solutions that protect against that transmission. The most important thing to remember, though, the transmission has more to do with our behaviors than anything else. It's the behavior of our putting unprotected gourds up in the trees. It's the way we raise animals. It's the way we market animals in animal marketplaces. All of those speak to high areas of risk that we can better manage And there are solutions for being able to raise animals, collect date palm sap in ways that minimize people's exposures. But it means, one, having the science that allows you to understand how the transmission occurs, and two, using that insight to think about local solutions that provide sustainable protection. So I'll stop there.
Thank you, Dennis. It's just what an amazing video. And I think this would be a great solutions journalism story that some of my colleagues practicing journalism every day. This is in itself a fantastic story, the bat and how it works and how simple solutions with addressing human behavior can make a big difference. I have another question that came in for Dr. Bedford about antimicrobial resistance, which is something that not everyone is super familiar with. Dr. Bedford, another way that an epidemic or a pandemic can start is through resistance to antibiotics. You're involved in antimicrobial resistance at FAO. And FAO has developed the Barbados National Action Plan on combating antimicrobial resistance, with goals like integrated healthcare systems, as well as prevention, detection, and control of illnesses and deaths related to infection caused by antimicrobial resistance. How is the current AMR situation in Barbados? Are AMR cases being detected in people and in animals? Antimicrobial resistance, did you get? Dr. Bedford, can you hear me?
Hi, Vino. Could you repeat for me, please? My connection is very bad.
How is the current antimicrobial resistance situation in Barbados? And are antimicrobial resistant cases being detected in people or animals?
I think as it is across the world, we are having some cases and they are being detected in humans. For now, I don't believe we're actually testing to see if it, well, yes, because you will have some cases of antimicrobial resistance, because in day-to-day practice, you will note that medication that used to work before is for certain things are no longer working. Antimicrobials are no longer working. So we are seeing that, but that is more of a global phenomenon.
Thank you. Thank you so much. I have a question for Professor Aurora. Are there environmental changes in the Caribbean region that increase the risk of zoonotic diseases emerging and spreading? What does your research tell us about localized threats of future epidemics, and how prepared is the region to withstand future threats of disease outbreaks?
Yeah, very good question. And we've talked a little bit about, how the environment impacts on the incidence and the prevalence of infectious diseases. And of course, one of the things that's happening in the Caribbean, more than in other parts of the world, because we're small island development states and incredibly vulnerable to global warming. Yes, we are seeing, as Dennis was pointing out, with things like especially the vector-borne diseases, like we're seeing the likely spread of the mosquitoes that transmit, the Aedes mosquitoes that transmit vector-borne diseases. They become, at higher temperatures, more able to transmit the viruses. So we need to carry out the work to look at how the impact of global warming, of climate change, is going to affect these many vector-borne diseases that we have. We're seeing a big outbreak at the moment around the Caribbean of dengue, as a lot of people know. And so when these particular viruses appear, they're more likely to spread than they used to be because of the increase in temperatures. And other things are also happening in the environment. We mentioned about hotspots as well. I mean, Dennis quite rightly said we don't have so many hotspots in the Caribbean, but we do have hotspots close by in the north of South America. So we have risks from viruses and pathogens appearing in hotspots in Venezuela, in Colombia, in those areas. And as we know, I'm in Trinidad and Tobago now. Our southern borders are quite porous, so people and animals potentially infected with these pathogens are coming across. So yeah, I mean, I think there's a lot of things we need to take into consideration in our research when we're looking at the prevalence or the incidence of infectious diseases. And it's really important to look at the impact of the changes in our environment that are happening because of our climate that's changing. So it's a good question.
Now I have a question that really could be, anyone could answer this, but maybe Professor Oura or Dr. Dennis. And the question is, make sure this came up via WhatsApp. Should One Health approach in the Caribbean be driven by global pandemic plans? Should the One Health approach in the Caribbean be driven by global pandemic plans? Maybe Professor, and then perhaps from a local perspective, and then perhaps Dr. Carroll.
Yeah, I think we have to learn a lot from global pandemic plans. That's what we don't do enough of. We don't have enough collaboration across different parts of the world. We have an enormous amount we can learn from others, and the Caribbean is small, and so we do lack expertise in certain areas. So as much as we can learn about global pandemic plans, the better. But we also have to remember that One Health is much wider than just global pandemic plans. One Health is looking at how we address these complex, wicked health problems that include a lot more than just animal diseases or diseases that pass across from animals to humans. So we have to take into consideration antimicrobial resistance, which needs a One Health approach, climate change and its impact with health, and that's not just absence from disease. That's a much broader health definition, including environmental, social, cultural, economic determinants of health. We have to look at food security. We have to look at food safety and what is required in order to make sure that we can feed that massive population that Dennis was talking about, and critically water, provide safe and secure sources of water. So yes is the answer to the question. It is important to learn as regards to global pandemic plans that are happening at the moment, absolutely critical. But we have to, One Health is all a much broader approach to that, how we address much more complex and serious health issues, or not more, but the many multiple complex health problems that we face.
Great.
Thank you.
Yes, I would agree with what Chris just said. I think the global plan should inform, but ultimately the local plans need to leverage local capabilities and respond to local needs. And it really is about if you will, an all of society approach. Everything that Chris just spoke to, what we learned from COVID and we've seen elsewhere, it's not just a health issue. Being prepared means you have all aspects of society being able to prepare for and respond to the challenge. So certainly hospitals and clinics need to be prepared, but communities also need to be prepared to deal with essential services. So the issue of food safety, food security, water, electricity, all of those issues are extremely vulnerable during events of this type. And so we saw that the consequences of COVID-19 spread across our economies, had huge social and political impact. And so you need to really think about what the global plan might tell us about evolving risk elsewhere. But you need to be thinking in greater detail about how that may then impact on the local communities. And then what are the capabilities, the resources, and the needs that need to be addressed to really build the kind of resilient society that is able to deal with not just a health crisis, but an all of society crisis. I'll stop there.
Thank you, Dennis. Thank you for that thoughtful answer. Let me check. I know I have a question. There's a few more minutes. Maybe I'm just gonna kind of open the can of worms, but I want to ask about funding for One Health, because frankly, this collaborative approaches probably require quite a bit of funding. And how feasible is to get funding ahead of an emergency to better prepare? And where is the funding coming from? Where should it come from? And I'm gonna just open the floor, anybody who wants to comment, but perhaps starting from the global, Dennis, and then going to the local, the colleagues in the region.
Well, we have seen even prior to COVID-19 that when there is an event unfolding, resources have a way of becoming available. We saw it with Zika, significantly larger resources than were typically available. But then after these events, the resources dry up. Sustainable investment is really a challenge. I would go back. I mean, part of this is that we have to have a long view. And I would go back to the point Chris was making earlier about building a new generation, the next generation of leaders, that they have understanding what the core requirements are for effective One Health. Whether you're a physician, an environmentalist, a veterinarian, a forestry, whether you're working in the government, at the national or at the community level, whether you're in the private sector, you build that next generation. They're going to have a much deeper understanding about the connectivity, about how these things interconnect and the importance of building systems that are less stovepiped, as you mentioned earlier, Bay, to ones that are much more interconnected, and very much the way Mother Nature is very interconnected. And unfortunately, our professional systems have lost that interconnectedness. And so I would think that one approach to dealing with the long-term strategy of funding is building that next generation of leaders in the public sector and the private sector that will make fiscal decisions, that they're better educated about the value and the importance of how these things play themselves out. Now, if I may, just for a moment, I just want to ask Chris whether or not I very much like the way you talked about the educational experiences within your community, whether you have any connectivity to the One Health University networks in Africa or in Southeast Asia. There are about 200 schools, veterinary schools, medical schools, nursing schools, environmental schools that are part of a university One Health network that is specifically about building core competency among that next generation of professionals, as well as doing in-service training for the current generation. And if you're not, I'll be glad to make some connections for you. But I think that they've built a very strong system and particularly highlighted the core competencies for One Health for those professions that may be of value for the Caribbean. I'll stop there.
Yeah, thanks very much, Dennis. I'd very much like to get those connections. I have been pushing, been to various countries in Africa. I was in Uganda in July, talking to Makerere University about One Health, and they have a One Health network there. And actually next week, in fact, immediately after this session, I'm talking to guys in Mozambique because they have a conference around around climate change, but also One Health. So more. Not that I don't have that link. I don't think those links to this big organization you're mentioning, and I'd very much like to have it, because I think when I talk about the work we've done training professionals in One Health and climate change and health around Africa, they are very, very interested in the approach and the way we're doing it. And I'd very much like to get some funding to maybe extend the fellowship program that we're doing into some other regions of the world. And Africa and East Africa is an area that we're looking at. So yes, please send me the
Well,
info.
Macquarie is the host for the AfroUN,
yes,
which is in Africa, One Health University Network.
Yes, I was there in July. I've been there a couple of times and talked to the guys there. Yeah.
So we have only a few minutes left. Sorry to interrupt, about 5 minutes. And I did want to give the word about to Dr. Bedford and to Wesley about this issue of funding, because they have expressed interest in commenting on that particular question. So Dr. Bedford, please.
Thanks very much, B. From where I sit as a consultant working in AMR in the region, it is extremely difficult to get funding. I know the question is, where should funding comes from? The Caribbean is actually a very we're resource poor in a generalized way, and especially after COVID. COVID really destroyed many of our economies, and we're now trying to recover from it. So we have to look externally for funding. And because many of our countries are deemed medium income and high income countries, or high medium income countries, we're not eligible for funding. And that is a huge problem. We have many needs. We have persons that are willing and able to work in the field, but without funding, without money, we can't do anything. I'm hoping to meet with some donors in next month to see if we can get some funding for the region to start doing work in the region. And before I go, I just wanted to agree with Wesley when he spoke about the things that journalists can do. I think one of the most important things is to fact check. Even if you're speaking to resource persons, knowledgeable persons, fact checking is a must. So I think with fact checking, that also will build more buy-in. You will get more buy-in from the public, and they can see exactly where the sources are coming from and other sources that agree with what is being spoken. Thank you.
Thank you, Dr. Bedford. Thank you so much. And Wesley, maybe a few comments about this issue of funding from where you stand.
Yeah, well, I don't see the issue of funding as not really unrelated to Judith's question about the global versus national interface here in the Caribbean. There are few places in the world that are as global as we are, starting from where all of us came from, and especially when you go into the current reality where every single important sector, whether you talk about tourism, energy, food, has a global interface, a very key and important global interface. In terms of the funding, there is the global perspective on that, but there's also a national perspective, because if there is this global interface and the One Health concept that is also global, then every single sector, every budget line within our domestic budgets ought to have an open health, a One Health approach. I keep saying open health because part of this whole thing has to do with transparency. People need to know what is going on. And if they know what is going on, they're more likely to support what you're proposing rather than to oppose it.
Thank you, Wesley. I love this open health and One Health, just this wording, because it's about transparency. That's a very good point. So I think we have 1 minute to go. I just want to mention that this conversation is part of a One Health toolkit that this project is developing and that will be shared widely in the region for sure with information providers, and also with beyond the region with other people interested in covering One Health or in working in One Health together in this approach and in kind of fostering collaboration, because we've heard this is essential for implementing One Health. So I just want to thank all the panelists today, and a special thanks also to Dr. Dennis Carroll, my former colleague. Thank you very much for your insight and for your service really to global health and to this issue of zoonotic diseases and emerging pandemic threats. So I want to remind folks that this conversation is going to be available in a recording on the Internews Health Journalism Network YouTube channel and playlist, and we will share it in the toolkit. Thank you again for the participation, and bless you all.